Good evening, everyone. I'm Michelle Leifer, the director of the USDAN Institute for Animal Health Education at the Schwarzman Animal Medical Center. Along with my colleague, Valeria Menendez, I'd like to thank you for joining us for tonight's webinar, Dental Health for Dogs and Cats with Dr. Brad Cingolani, resident veterinarian in AMC's Dentistry and Oral Surgery Service. This webinar is for informational and educational purposes only and is not intended to substitute for professional veterinary medical advice, diagnosis, or treatment. If you have questions or concerns about your pet's health, we encourage you to reach out to your veterinarian. Tonight's program is being recorded and we'll send a link tomorrow in case you'd like to revisit any part of the presentation or share it with a friend. We'll be taking questions through the chat box and we'll reserve time at the end to answer as many as possible. I'd like to take a moment to share details about next month's webinar, Meeting Your Dog's Needs, featuring Dr. Vanessa Spano, veterinary behaviorist at AMC, and Maddie Messina, a certified applied animal behaviorist. That webinar will take place on Wednesday, March 25th at 6 p.m. on Zoom. You can register at amcny.org/events, and that link will also be included in our newsletter going out this evening. And now it is my pleasure to introduce tonight's speaker. A native of Westchester County, Dr. Brad Cingolani earned his veterinary degree from the Purdue University College of Veterinary Medicine. He then completed a one-year rotating internship in general medicine and surgery here at AMC. Following his internship, he spent a year in general practice in New York City, where he gained extensive experience in dentistry and other areas of veterinary medicine. Dr. Cingolani then returned to AMC to begin a residency in dentistry and oral surgery. We are thrilled to have him with us tonight to lead his first USDAN Institute webinar. Please join me in welcoming Dr. Brad Cingolani.
Hello, everyone. Michelle, thank you so much for the introduction. I really appreciate you all taking the time to be here with us tonight. It means a lot to us. I'm really happy to share all this information. So let me just share my screen here, and then we'll get started with the presentation. All right. Can everyone see that? Okay, amazing. So again, topic for tonight, we're going to talk about oral health for dogs and cats specifically. We're going to go over the signs, treatments of some very common diseases and abnormalities that we see on a daily basis, and then we'll get into some at-home care and also talk about what procedures look like for your patients and our patients and your pets, excuse me. So I want some basic things to be understood, and I want you to leave this lecture tonight understanding the relevant anatomy and structures of the face that we deal with on a regular basis and what you could be looking at home as well when you are just laying down with your pets on the couch. I want you to understand what the most common oral health conditions are in pets and really define what dental disease entails for dogs and cats. I would really love to encourage at-home dental care and review the at-home dental products as well, so there won't be so much confusion about what's on the market. So again, we're going to go into the anatomy, talk about periodontal disease, another condition called feline tooth resorption, and go over some things related to trauma to the face and pets and to the mouth. We'll talk about symptoms, the treatment. We'll go over what you can expect from a dental procedure as well, and then also just the recommendations for at-home care and the products. So this is just an image of an oral cavity in a dog here on the right. We'll stick to dogs for right now on this slide. Dogs have 42 teeth, and their skulls comes in various shapes and sizes, but they can kind of be broken down into short faces, which are brachycephalics, middle average size ones that are mesocephalic, and then the long nosed ones, which are dolichocephalics. They have a joint that connects the top and the bottom of their jaw. It's called the temporal mandibular joint. And it's really the same as it is in humans. It's a hinge joint, and in dogs, there's a little bit of side-to-side movement, but you might be at home thinking, oh, I can move my jaw left to right a little bit. Dogs can't do that as much. And another relevant thing I would say for us and for you to think about as home is what we see above the gum line, the crown of the tooth. It's just kind of the surface level of what's going on. The teeth go really far down into the bone there. So in some animals and dogs, you can see 2/3 of their lower jaw and upper jaw are taken up by the tooth roots. And again, this is a picture of normal oral anatomy in a dog. You have healthy gum tissue here. The crowns of the teeth are all nice and white. The spaces between the teeth are normal. And I like just leaving this here for you guys to think, this is what my pet's mouth should look like. And you could probably think of your dog when it was a puppy and think, oh, this is what his mouth used to look like. Maybe things have changed since then. So again, a little more nitty-gritty oral anatomy, but this is really just to highlight the nerves and the blood vessels that go into the face. The face is a very vascularized structure, meaning there's a lot of blood flow to it, and has a lot of innervation, so a lot of nerves and a lot of sensory input, which makes sense. They move their face a lot. They could feel a lot too, when you're petting them, but it also means they feel everything that goes on in their mouth, just as we would, even slight bits of pain and discomfort. So the top jaw here is called the maxilla, same as us in people. And the lower jaw is called the mandible. And again, same structure and sort of look as it is for us. And you have a lot of blood vessels that run on the lower jaw and on the top jaw. And same thing, the nerves follow the same path as the blood vessels. Switching to cats for a minute here. So cats are a little different in the sense that they have less teeth. So compared to dogs that have 42, cats have 30 teeth. They also have various skull types, long noses, short noses, your average domestic short hair kind of middle nose. But overall, their oral cavities are pretty much the same, and it doesn't really change the shape and function of their teeth versus it does in dogs a lot, and we'll get into that in a little bit. But they also have a temporomandibular joint or a TMJ, except theirs has no side-to-side movement whatsoever. It's really just this snapping close that the jaw does because they're carnivore species and that's what they do. They bite down, they chomp, they shear on things. These pictures I really like because I think it gives you a better idea of what you're actually looking at when you are looking at your cat's head. These teeth here, you could see really half of the tooth is all that we're seeing at surface level. Their canine teeth go way down into their jaw and up into their jaw. Their premolar teeth and their molars, same thing, really go far down. So it's just understanding that an issue above the gum line may not really reflect really what's going on below it. And then two, this is kind of what the skull structure of our domestic cats look like. So when you're petting your cat now, this is what you can think about. Another thing too, this is just talking about occlusion or bite that you think of in ourselves too. So normally dogs have what is called a scissor bite. The teeth interdigitate or kind of just go in a scissor pattern between one another. And with that being said too, this is a good reference for what is normal. There are many deviations from normal, but again, this is a normal, healthy mouth. All right. So we're going to talk about the tooth and the teeth themselves. The anatomy is pretty much the same as ours with variations of how they appear, but kind of at a biologic and structural level, they're pretty much the same. So the tooth is covered by the substance called enamel, and below the gum line, there's a substance called cementum, which is kind of like the enamel under the gum line. Below that is a substance called dentin, which serves for some sensory function and some reparative function on the teeth as well. And then in between all that is the root canal or the pulp chamber, the highly vascularized and neurologic portion of the tooth that provides sensory feedback to the body. And again, this picture is just to serve as an understanding of what we're actually looking at from the outside of a tooth. And it relates to what we view on x-rays and how we treat these patients. A little bit more, so this one's specific of kind of the structure that houses the tooth and keeps it in place. So the periodontum, it's the supporting structure for the teeth. So these structures, again, the same in people as they are in dogs and cats. There's four structures. Again, the cementum, so your enamel kind of under the gum line, the alveolar bone, or just the bone that your teeth are sitting into, your tooth socket, a periodontal ligament, which is a true ligament surrounding all the roots of the teeth, and then the gingiva, or really just the gums, the pink stuff that surrounds the teeth. And the function of the periodontum is to anchor the tooth into its socket, cleanse and protect the tooth with some antimicrobial functions that it has, and really provides sensory feedback. So when we bite down on things or animals bite down on things, we could feel it and we know if it's right or it's not. So jumping from that slide into the most common disease that affects dogs, it's periodontal disease or periodontitis. And it's an active inflammatory process of the periodontal structure. And it's caused due to a buildup of plaque and calculus accumulation. So again, affects 70 to 80% of all dogs and cats. It's more common to see it in our patients than not, unfortunately. And let's go through a little bit of why this happens and how it starts. So bacteria colonize and build up on the teeth very rapidly, even right after the teeth are cleaned, like when we go to the dentist and get our teeth scaled. So within hours of a cleaning, bacteria are already colonizing on the dental pellicle. And the pellicle is a substance that's made up of these salivary proteins that just normally coats the teeth in everyday life. In one day or so, a biofilm forms over this plaque that's going to help protect the bacteria against anything that tries to get rid of it. And then the biofilm is going to mineralize in 2 to 3 days. And at that point, it's really hard to get off with a normal toothbrush. But it's really just this calculus formation that's the root problem of periodontal disease. Again, let's look at this picture on the right here. So these are different stages of periodontal disease, which will be important to remember when we talk about treatment options and what we're seeing on dental x-rays and what's guiding our treatment decisions. So plaque will build up on the top of the tooth here, the supragingival region above the gum line. And over time, it leads to subgingival plaque, so below the gum line, meaning subgingival. The biofilm that we just talked about is going to protect the subgingival plaque, and that's what's really causing the biggest issue here. The body, as a response to this inflammation, because you got this bacteria in a place where the body doesn't want it, it's going to become very inflamed and lead to tissue damage and bone loss. And then the bacteria over time will make compounds like ammonia and sulfur, and also release some enzymes that cause destruction of the periodontum or, the tooth supporting structure. With periodontal disease, those different stages we were just looking at, there's the earliest form, which is gingivitis, and that's just an inflammation of the gums. If you look on the left side of this picture here, that is a reversible stage of periodontal disease. And what happens is you basically clean all the plaque and tartar up from that area, and in 2 to 4 days after cleaning, then we see the gums really quiet down and become less red. On the other hand, though, when gingivitis progresses to periodontitis, like you see here on the right, we're getting attachment loss. So all the supporting structures of the tooth, the alveolar bone, the gums, the periodontal ligament here, are all starting to recede away. And that is a non-reversible process, unfortunately. There are things that we can do in select patients to reverse the process, which we'll talk about in treatment a little bit later. But I'm just kind of hinting at something called guided tissue regeneration or bone grafts here. But within 1 to 3 weeks of you noticing gingivitis, periodontitis can progress. So what are some risk factors for periodontal disease? If you have a smaller toy breed dog, unfortunately, they're the poster child for this. Also, our long-nosed dogs, think of dachshunds, greyhounds, poodles, and such are very prone to this. And a lot of purebred dogs as well, like miniature schnauzers, Malteses, sighthounds like Italian greyhounds and whippets, and greyhounds like we mentioned. Cats as well get periodontal disease. It's not just confined to dogs. So usually we see this more commonly at least, in the exotic and purebred cats like Abyssinians, Somalis, Persians, and Burmese, but no cat's exempt from this, unfortunately. And some abnormalities that are risk factors associated with periodontal disease have to do with the actual anatomy of the teeth. So when we look at teeth themselves and they're not spaced out in a scissor bite fashion like we were looking at before, and they're crowded on one another, that can cause for plaque and bacteria to build up faster. Malocclusion, so if their bite's uneven and they're causing for other wear and tear. And persistent baby teeth that are next to the adult teeth cause that crowding space, and the body can't clean it. You can't clean it at home with a toothbrush. So That's another risk factor. There seems to be a genetic predisposition as well to periodontal disease. We don't really have a clear understanding of why that is, but we know that there is some portion of genetics that come into play here. And then along with that, we have systemic health and altered immune responses that can change how the body responds to inflammation. So diabetes is a very inflammatory condition where you can be more prone to periodontal disease from it. And periodontal disease leads to systemic inflammation, which can make diabetes harder to regulate. And then we have a lot of patients that are on immune modulating drugs for immune-mediated diseases that also we see those patients with periodontal disease. And as dogs get older, unfortunately, periodontal disease is more common because they go a longer period of time without having their teeth cleaned. That gives more time for plaque and bacteria to build up, so on and so forth. Let's get into the systemic consequences of periodontal disease. And I would like to highlight too that this is really well known in human medicine. We don't have the as developed in specific research in veterinary medicine to correlate one with another yet, but we're working on that. So periodontal disease and oral disease can lead to the systemic disease and vice versa. In humans, inflammation and infection from periodontal disease can lead to cardiovascular disease, systemic inflammatory diseases, neurologic diseases, cerebrovascular events, or you could think like a stroke and pulmonary disease. And again, like I was saying before, in veterinary medicine, distant oral organ changes in the kidney, liver, and heart can be seen, and systemic inflammatory signs can be seen as well. Bacteria in the bloodstream related to periodontal disease. But we don't have like a one-to-one relationship. There's no study that says this animal had this bacteria issue in its mouth. It's found in this area. And things aren't as clear as that in research either. So again, we're working on that. But again, then we got to talk about some local consequences and why does it even matter if our pets have periodontal disease. So this image here shows a broken jaw in an animal, and it's called a pathologic jaw fracture. So normally in an x-ray, we'll go over some normal ones in a bit. But if you look here, this is where the bone is supposed to come up to on the tooth. All of that bone loss is secondary to the body's response from periodontal disease from plaque and tartar. And after time, unfortunately, it eroded the bone away in this dog's lower jaw, and the bone fractured as a result of that. You can also have fistula, which is a communication between two cavities in the body, specifically in the mouth. It's between the mouth and the nose, and you could have connection because of that, oronasal or oral-antral fistulas. Teeth become very mobile. You could lose teeth, and that's actually a pretty common thing that people come into us and say, my dog lost a tooth today. Why? And we look in their mouth and say, wow, you know, he's got really bad periodontal disease. And then again, I think this happens very commonly, unfortunately, tooth root abscesses. So the tooth gets infected and the infection persists, and then you kind of see this big blowout infection because of it. Very common to happen on the upper jaw and affect the area around the eye. Very painful, very much an acute issue, happens very quickly, even though the periodontal disease had been brewing for years. So some symptoms you might see, they might have halitosis or bad breath, gingivitis like we talked about, their gums might bleed intermittently, plaque above the gum lines. It might be painful from it too, because it can be very uncomfortable for them on a chronic basis. They might not like you petting their heads anymore. They might paw at their face, drop food while they're eating it, excuse me, sneeze, and have oral discharge like we talked about for that fistula communication. Their jaw might move abnormally when they're eating. They might not want to eat certain hard objects like their crunchies and really only want to eat wet food. And they also might have decreased appetite in drinking, but there's an asterisk next to that because it's usually not the teeth. In order for dogs to and cats to not want to eat because of their periodontal disease, the pain's got to be like a 10 out of 10. And again, we talked about 70 to 80% of our pets at home have periodontal disease, and they're still eating. So just as a note, if for some reason your pet's not eating or drinking, it is worthwhile to get them assessed for a systemic issue, which is more likely in that case. But then again, you also might see them drool more, hypersalivate, and have draining tracts from abscesses. All right, talking about treatment, and we'll get into the exact mechanism and talk about general anesthesia in a bit, some slides later. But we treat these patients with periodontal disease with a periodontal cleaning under general anesthesia. We start off by rinsing the mouth out with an antiseptic to decrease the bacteria from aerosolizing in the room. We scale the teeth, we polish them. Sometimes we add an oral sealant, which can help reduce plaque and tartar buildup. It depends. It's a case-to-case use product. If you're brushing the teeth at home, the products have little benefit. But then based off the amount of periodontal disease in each tooth, we have to make a decision on, can we get away with just cleaning it? Is it something that we need to remove because it's so diseased? Or can we do something called guided tissue regeneration or bone grafting? So we remove teeth that are far beyond us being able to save them or repair them, that are just nuisances for infection and pain in animals. We can root plane teeth that are in this borderline area and just clean them out really well and let the body sort of heal from the inflammation. But we're never going to cure periodontal disease. And then on the flip side, in very certain patients with specific types of bone loss, we will do bone grafts that actually help make new bone in the area and help keep teeth in place. We try to reserve that for teeth that are really important for chewing, and we try to reserve it for pets who are otherwise systemically healthy, because something to know about that procedure is that it requires follow-up and it requires really good at-home care with brushing. So if your pet really is resistant to brushing, you've tried everything, if you're not willing to do anesthetic procedures every 6 to 12 months with them, doing something like a bone graft might not be the best thing for you and your pet. But again, it is something that's really useful for helping save teeth. And then everyone might think, well, this is a inflammatory condition related to bacteria. Why don't we use antibiotics for it? It's because the antibiotics are not going to actually cure the periodontal disease, because if not getting rid of the bacteria in the mouth, there's already a ton of normal bacteria that just are in the mouth to begin with. And we're not treating that or changing much by just giving a dose and a course of antibiotics. We will use antibiotics for specific patients and conditions, however. So patients that are immunocompromised, patient that has other systemic comorbidities like really bad endocrine disease that we aren't able to control and we had to do a procedure on them under duress for some reason. But we really try to limit usage just because antimicrobial resistance is a growing issue in veterinary medicine and is definitely an issue in human medicine. So transitioning now to second topic of the evening, feline tooth resorption. This is a very painful process for cats. What happens essentially is the body starts to resorb the teeth. And we don't necessarily know the cause yet, but this picture here just kind of highlights to you what a normal healthy tooth looks like, and then going through the stages of tooth resorption. So in the beginning, it's not so bad. There's a little bit of issue with the enamel and the cementum here, and then you could see how it rapidly progresses and really just decimates the tooth and can be very uncomfortable for cats. So again, it's an erosive process of the teeth in cats, and the hard tissues are reabsorbing the surrounding bone. 25 to 75% of cats are affected by this, and it is one of the most common diseases affecting cats in general. You get resorption of the roots of the teeth, the crowns, so the tops here break off, and then you get these like open wounds essentially in the mouth that are either open to the outside world and are painful when they eat, drink water, or pass air across their mouth. And then you could see in this picture here, this red gum is not normal. And what happened was the body had a defect in the tooth. It tried to seal it off by, expanding its gum across that and having this inflammatory granulation tissue to fill in the defect. It's just this inflammatory response. But this is a telltale sign that there's something going on with that tooth that we just can't see because the gum's covered it up. Doesn't mean it's not painful. It's just a sign that we need to do something. But a third of all cats will develop tooth resorption and have 1 or 2 lesions in their lifetime. We really want to know the cause of this. We currently suspect that tooth resorption might be related to a viral load in patients. It could be related to some sort of heavy metal intake by patients, but there are current studies investigating all of that as we speak. I would like you guys to just look at what a normal x-ray looks like on this left, and then just see here on the right, we'll talk about in a sec. So these are what the teeth look like under the gum line. Crowns are here. This cat actually has an extra tooth, believe it or not. So not exactly normal, but it's not an issue for this patient. And this is just what the healthy periodontum and teeth look like. Same thing on the lower jaw. Good gum, good bone here, and it's very healthy. The roots are perfectly intact. And then we transition over to its counterpart. We have this kind of Pac-Man lesion, or something was bitten out of the tooth. That is characteristic for tooth resorption. And you could see that it's really invading the body and of the tooth, and it's hitting that neurovascular structure in the tooth, the root canal. So it's painful. Same thing, the body here is just kind of condensing all the roots of the teeth and reabsorbing everything. So it's uncomfortable for our cats. What are some symptoms though? So they might drool a lot. You could see some blood in that drool. They might have some difficulty chewing. They might drop food. You could smell bad breath on them. They might paw at their face. And sometimes they have behavioral changes too from the pain and discomfort. And again, like in dogs, when we talk about periodontal disease and for cats with periodontal disease, we can see things with tooth resorption like weight loss and reduced appetite. Again, there's many causes for those things, and it's usually not the mouth. So it's a good idea to have a full systemic workup to investigate those before putting a pet under anesthesia and having to go through a full dental procedure. All right, let's talk about treatment of tooth resorption. So similar thing, it's a periodontal cleaning under general anesthesia to start. Same exact way we do it for every single patient. Rinse their mouth out, scale, polish, take x-rays, chart each tooth, and really understand what's going on and how to diagnose the issue. Unfortunately, the only treatment for tooth resorption is to extract the teeth. That's because there's nothing we can do to actually fill in the defect. It's an erosive process. It's only going to get worse. So thankfully, they do really well with removal of their teeth. And we have cats that have no teeth who are living very comfortable lives and are better off for it to have tooth resorption, but that's just something for you to know. This here I posted and I want you just to see, this is not a live patient or anything like that, but I just want you to get a sense for what an oral surgery on a big canine tooth and a cat looks like. The dotted line here represents where we'll make an incision. This one here is where we lifted up the gums. We took some of that surrounding bone off here. The bone normally comes to right about that level. We took some of the bone off and exposed the root of the tooth, and then we actually removed that tooth and we'll stitch the gums back up. But I know that everyone has probably had a pet with a tooth removed before. It's just for you to understand that, there's a process that goes into it, but they usually do really well with the procedure and recover nicely. Transitioning from those two issues to our third issue of the night, being oral trauma. So we have what are called dentoalveolar injuries or issues to the tooth and the surrounding gums. You have soft tissue injuries like lacerations, and they can also fracture their jaws, facial fractures. What are the causes? It includes chewing hard objects, inner animal aggression. Think about dog bites, cats attacking each other, playing, falling off of higher objects, or even the couch, depending on how bad their periodontal disease is, it can break a jaw. Vehicular trauma, unfortunately, pets get loose. And we'll talk about high-rise syndrome too, which is an issue that affects cats that was actually described here at AMC. This picture is highlighting a fracture in a tooth, showing that its root canal is exposed. And this one here is another jaw fracture. Unfortunately, we do see them pretty commonly. So dentoalveolar trauma, like we said, it's trauma to the tooth and or the surrounding tooth structures, whether it's bone or soft tissue. Some symptoms are pain, bleeding from the mouth. The tooth might be out of position. They might not want to eat and their face might become swollen. Another thing is you might see the signs pretty acutely from the time when they fractured a tooth. It might happen suddenly, like, they don't want to chew that toy anymore for whatever the reason may be. When we look over to the right here, we have the two most common types of dentoalveolar injuries, complicated and uncomplicated crown fractures. When something's uncomplicated, it just means that it doesn't involve the root canal. When it's complicated and involves the root canal, that's when we actually have to do something like treatment for it. And we'll get into treatment in just a sec, but you can see here, these are all the different ways that pets can traumatize their teeth from chewing on things that are too hard for them, or getting hurt in an injury like from another animal or a vehicle like a car. And when we talk about these teeth traumas or trauma to these teeth, excuse me, we also want to talk about how we repair them. So in cases like this, where it's a complicated crown fracture and the root canal system, that sensory system, is exposed to the outside world, we actually need to do something. And one thing we can do is a root canal, just like we do in the humans as well. It's a lot less painful for veterinary patients because they're under anesthesia. So the negative stigma that you might have if you had a root canal isn't necessarily the same for them. And what's nice about it is that it will restore the normal function and structure of the tooth and save the tooth. Another thing we could do for these cases is simply remove the tooth. When they have these types of injuries, they usually die a little bit afterwards. So we have to do something about it, and extracting them is an option. And then lastly, depending on the types of injuries, we could splint and like bridge the teeth together. Those are for select cases and select patients. It's not always the best option, but it absolutely is an option. And we like to do what we can. So these are some images highlighting what we kind of just talked about. This tooth here, just believe me a little bit for a sec, had something called pulpitis. So, or just inflammation of the root canal system, the pulp system. It's all synonymous with one another. You see this like pink sort of deformed colored tooth, and that's because that vascular bundle, the blood supply of the tooth, got traumatized from something like trauma from biting a toy that was too hard, or a chew toy, or playing with a stick or something like that. And what happened is with that is the tooth dies from that, unfortunately, and bacteria can rapidly colonize and cause infection. So we need to do something about it. What we did in this case was a root canal. And again, this was the tooth before, and this is what the tooth looked like after. So you could see there's a filling in place. We took all the dead and sort of necrotic tissue out of there and put a cap on it. And in this case specifically, we applied a prosthetic crown like you might have on yourself, which we can do for patients, which is a nice option depending on why they broke those teeth. Talking about facial and jaw fractures, so overall occurrence or prevalence of this is about 2 to 3% of all broken bones in dogs. The lower jaw, the mandible, is way more common than the upper jaw, the maxilla, but we see both. And the middle of the jaw, this section here that we're looking at, is actually the most common place for it to happen. So how do we treat this? What are we going to do for these pets? There's a couple options, depending on how the fracture looks and depending on the skull conformation as well. We'll kind of make decisions based off of the diagnostics that we get. So one thing we can do, like we did in this case, is a non-invasive technique where we put the fracture back together and applied a wire over the top and covered it with a splint. And it basically applies a non-invasive covering and it keeps the jaw aligned and in place. However, other options exist, like opening up the skin and the gums and placing a plate, which you might think of when we think of, boxers and things like that. In humans, they get jaw fractures. They place a lot of plates on those patients. It all just depends on what's best for the patient, and we make those decisions usually at the time of the surgery. We're well equipped to move to either procedure based off what we find. One thing to just recall from the oral anatomy section of this lecture, we were talking about how big the tooth roots are in relevance to the actual size of the jaw. So this tooth in particular, you could see it takes up most of the entire bone of the mandible. And that's just something to consider when we talk about these fractures, because the fracture might not only affect the bone, it might actually affect the tooth itself. And those are all sort of things that complicate and change our decision-making process for these trauma cases. Another thing that can kind of make these things complicating is, if we remember this picture from before, that pathologic fracture as a result of the periodontal disease, there's not much bone to put back together here. So we have to get a little creative. There's some bone grafts and special implants that we can use, but this is just to kind of raise your awareness on how we fix these things. But our main goals are to make it so the patients are comfortable, their bite is normal afterwards, and the jaw is a really solid, rigid structure. Talking about high-rise syndrome, so this is a issue with cats when they fall from high-rise buildings. And it was described here by AMC back in the 90s. And it's you commonly see pets, cats specifically, excuse me, falling out of windows kind of, in the springtime or fall when we get to open our windows again. Maybe the screen came undone, maybe we don't have a screen, or whatever the reason is, and they fall out. Thankfully, these cats actually do really well and have a greater than 90% survival rate. But it's just noteworthy to say that 66% of all these cats have orofacial injuries, which is more than half. So it's really common. We see it quite often. But just to also say about that, excuse me, please do your diligence to make sure that your screens are in place at home this spring when it comes and we're able to open our windows again, so this doesn't happen. So transitioning a bit over to what we can expect from a dental cleaning or a dental procedure for our pets. I'm going to talk a little bit about general things and then more so talk about what we do here at AMC. So overview for you to know whether you're interested in having a procedure done on your animal with us or with your primary veterinarian. You want to know just what their comfort level is with general anesthesia, which most practices are, but it's just something you want to make sure for yourself too. You want to make sure that the surgery is being performed by a licensed veterinarian, meaning the extractions, the endodontic or root canal treatments and things. Our nurses do a wonderful job with cleanings and with dental x-rays and a little bit more advanced procedures for the cleanings, but by law in the state of New York, veterinarians have to be the ones doing the actual oral surgery. You also want to check too that they have dental x-rays and they're doing dental x-rays on your pet. The reason for this being is there was a study published that looked at incidental findings and abnormal findings that needed treatment after doing dental x-rays. They found that 41% of patients had an incidental finding, meaning that something that was abnormal, but they didn't need to do anything about it. No big deal. But actually, a quarter of those cases as well, of all the cases they looked at, needed to have some involved treatment for what abnormality they found. So if you don't take the x-rays, you're not actually going to see what's wrong and what's going on. Another thing too is you want to make sure you're doing blood work before the surgery just to make sure your pet's systemically healthy. I say plus or minus to the chest x-rays here as well. The reason for that is, and why we do it, we get this question pretty often, is we're screening for abnormalities in the lungs that we can't pick up with our stethoscopes. We typically reserve this for patients that either have existing heart or lung disease or patients over 10 years old, because unfortunately cancer is more common in those pets or changes in their pulmonary lung pathology or their lung anatomy. And it's really better to know these things before putting your pet under anesthesia. And it's a good screening method too. So when this section of the day of the procedure, I'm going to speak more so on AMC and how we do things here. Your pet will get dropped off between 7 or 8 a.m. With our service, and they with us for the day. We do an exam in the morning. We'll give you a call before we start the procedure and just touch base prior to when we had our consultation with you and just see how everything's been going. We do point of care blood work here that just looks at their electrolytes. Not every place does that. It's not necessarily required, but we really like to do it to make sure that everything's as safe as possible for anesthesia. We do place pets under general anesthesia for every single procedure we do. And the reason we do that is because it allows us to have a more thorough evaluation of their oral health. It allows us to take dental x-rays. It allows us to carefully chart and probe each tooth, which is really important to identify where issues may be. And it allows us to actually clean underneath the gum line. I'm sure you guys have heard about non-anesthetized dental cleanings, which I understand as a pet owner myself why that is so appealing. But I do think for a lot of patients, we are not actually assessing if they have periodontal disease or not, if they have any abnormalities underneath the gum line, because we can't take dental x-rays when you're doing the non-anesthetized cleanings. And if they're doing as deep of a periodontal cleaning as we do under anesthesia, we're definitely causing a fair amount of unnecessary pain to those pets as well. Because those scalar tips can be uncomfortable, as I'm sure you felt yourself at the dentist office once or twice. That's just something to take into consideration. And I'm not going to sit here and pretend that anesthesia is without risks, but I will say pets do very well under anesthesia. We do a very good job of anesthesia here. Thankfully, we have a wonderful team of nurses and anesthesiologists that we can rely on. So that's also to the comprehensive oral health assessment and treatment. So we're going to do everything all in one sitting. When we find an issue, we're going to take care of it right then and there because we're not going to wake them up and have them come back for another procedure at a separate time. We're just going to get it all done at the time of the procedure that we're doing. And then after anesthesia, we wake them up. They go into a recovery suite here and they have some other nurses monitoring them to make sure everything's going well. And then they usually go home 2 to 3 hours after the procedure. Pretty typical for most patients. Definitely some variation depending on patients that have other systemic diseases and things that we're working on in the hospital if they need to stay overnight because they had a really big procedure or something. But all individual cases have individual needs, and this is just kind of the general overview for majority of our patients. Talking about recovery from a standpoint of what it looks like after surgery. So if it was a routine cleaning with nothing else done, they pretty much bounce back to normal the next day. Age definitely plays a role in that. Our younger dogs usually do really well the next day and they're kind of acting like nothing happened, versus our older patients definitely take a good 24 to 48 hours to kind of go back to normal. They metabolize drugs differently and it just takes them a bit longer, but they do well. And if they had extractions or some other procedure, we probably want them on soft food for at least 1 to 2 weeks. And other than that, just no hard chews, no anything that's going to disrupt the surgery sites. But they typically do very well post-operatively. A lot of them just feel better for it overall. So getting to more of at-home care. The number one thing we can do at home for our pets and their mouths is to brush their teeth. It's the same thing that we do for ourselves, and it's going to be the only thing you can do at home that's 90% effective at removing plaque and tartar from the teeth. You want to start brushing your teeth before they develop periodontal disease. So ideally, you get a puppy or a kitten used to what a toothbrush feels like, and then by 1 to 2 years of age, you actually start brushing more frequently, like on a daily basis. Some places in the mouth are harder to brush than others, like the insides of the teeth are nearly impossible in most patients, but we definitely have clients who are really good at this and have patients that are really compliant and do that, but it's not a requirement. We want you guys to focus on the outside of the teeth. But again, if they have periodontal disease, they're going to need to have the teeth cleaned because brushing is not going to be something that cures and removes all that plaque and tartar. So again, the best thing to do is every single day. If you can get it to every other day or 3 times a week, and it's just hard for you and your pet, that's awesome too. What you want to do is hold your toothbrush at a 45 to 60-degree angle. And again, you could use this for yourself too. And you want to actually brush the gum line. You don't want to focus on the tops of the teeth. And you just go in small circular motions on the outside of the teeth for 30 seconds aside. And it's just, you don't need to kind of shove the toothbrush down their mouth and make it a negative experience for them. You want to desensitize them as well when you're first getting them into this. Ideally, you kind of give them a high reward treat to lick off the toothbrush. Maybe it's cottage cheese, low-fat cottage cheese if they can tolerate it, or low-fat Greek yogurt, peanut butter if it's something they tolerate, or even some of them really love the toothpaste flavor. And for a couple days, just let them lick it off the toothbrush and get used to that it's a non-fearful stimulant. And just be consistent with it and really be diligent about the positive reinforcement. And again, I just like to keep reminding you guys, if your pet has a lot of plaque and tartar built up already, or already has a lot of periodontal disease, you brushing might actually make it more uncomfortable for them because there's probably pain and discomfort associated with it. So we want to clean those teeth professionally first before we start brushing. This video will not play on this slide for some reason. I apologize. We will send you some examples after this via email, one for cats, one for dogs that we have online here at AMC. So some toothbrush recommendations. No, we're not sponsored by this company. I think we should be at this point though with how much we recommend it. It's called the Nimbus toothbrush. It's developed by a human periodontologist. And what it is, it's this ultra microfine bristle that is really comfortable for the gums. I use one myself. They're very comfortable and my pets like them too. Some toothpaste recommendations. So this is kind of the most common commercial one that we see, CET enzymatic. It's a good one. Pets tend to like it. It contains these substances called glucose oxidases and lactoperoxidases, which are chemicals that essentially help the body remove plaque and tartar. And they combine with minerals and stuff in the saliva to actually make these antimicrobial agents that clean plaque and tartar or help reduce the plaque and tartar burden in the mouth. We don't need to use fluoride toothpaste in pets like we do in people. We use it ourselves because it helps reduce cavities. Thankfully, dogs and cats don't get cavities as much as we do, but fluoride can also be a little bit toxic to our pets as well, so just stay away from that. And then lastly, if your pet hates the toothpaste, just use warm water. It's totally fine. It's mostly the action of the toothbrush itself that's actually going to clean the gum line rather than the toothpaste, but it's kind of like a cherry on top. So talking about prescription diets, getting more so into the tree aspect of things, not just talking about brushing, there are some diets that are made that this mechanical motion of them chewing is allowing the plaque and tartar to be removed or reduced in the mouth. It doesn't replace toothbrushing. There was a study that showed that toothbrushing was 3 times as effective as these dental diets and treats. But again, they're a good adjunct to your at-home care. But if for some reason you start these diets and your animal's just like scarfing them down and not actually chewing on them, probably shouldn't feed it. You want them actually chewing on their food. It's not really going to do what it's designed to do. But they're really large, like kibble bites, essentially. They've got a bigger shape and more fiber, and it just allows this kind of scraping motion of the teeth that's still safe for the enamel. And there are some diets with polyphosphates, which is just another substance that helps control calculus and tartar accumulation. And the one thing I will say is anytime you do a diet change, just do it slowly. Talk to your veterinarian as well to make sure that this diet is actually something safe for your pet and that it's not going to cause any GI upset because we don't want that. This right here, too, in the lower right-hand corner, it's this group of veterinarian dentists that got together and formed something called the Veterinary Oral Health Council. And what they do is they review products on the market that have research backing, and anything that they have this seal on means it's proven to reduce plaque and tartar to some extent. These are just some examples of the diets. So we've got Royal Canin's a good one. TD, I think, is the most traditional one, and probably one that I've recommended the most to people. I think it's very available, and it's pretty much compatible with some other kind of conditions in pets like urinary issues and stone formers. So treats, again, these are all VOHC approved. We have Greenies, which everyone knows, the CET, Vedudent chews, and then Yummy Comes, which my dog is a particular huge fan of. She's a lab. For some reason, this is the only one that takes her a while to chew. But that's an important note. If your pet has these chews and they just chew them in 15 seconds, 30 seconds, they're not actually doing their job. The whole point of the chew is that there's some abrasive effect, but then they have some enzymes and chemicals that help like break down plaque and tartar or remove bacterial burden from the mouth itself too. So going back to when we were talking about the dentoalveolar injuries or issues to the teeth themselves, we're going to want to stay away from hard objects, and we'll talk about that next. So I wanted to highlight what are safe chew toys for the mouth. Think anything rubber, anything soft and plush. I think we veterinary dentists go a little back and forth on things like bully sticks and rawhide. It's patient dependent. Some patients have the ability to chew it, and their chewers, like bigger dogs, other small dogs, I've actually seen break their teeth. So just use those items with caution as well, please. But these are things you definitely don't want to use. So hooves, bones, ice cubes, antlers, yak sticks are like the hardened cheese sticks, tennis balls, and hard plastic toys can absolutely break teeth. And the rule of thumb is if you wouldn't enjoy actually chewing that and you think it might break your teeth, it's the same for them. It can break their teeth. And you might say, well, tennis balls are pretty soft. The thing is, the actual material on tennis balls, the nylon, makes this sort of kind of sandpaper-like material and can lead to abrasion of a lot of teeth. And I've seen patients with teeth that were like worn down to the gum line almost because they were just tennis ball chewers. They were nervous wrecks and they did it all the time. Another thing too, water additives, they can be pretty good. Again, none of these things are effective as brushing, but if you're going to do a water additive, you want to look at the ones that have zinc absorbate and zinc gluconate, They help control plaque and tartar via these methods and talk about just freshening their breath as well. Ascorbic acid and vitamin C are pretty good too. They're safe for the whole body. They're antioxidants. And common ones that we've seen or you can find online might be Healthy Mouth and MaxiGuard Gel. Although Healthy Mouth has been back ordered for a while, I just don't know the current status on that. But the CET one's also a good product. I myself have seen these marketed a ton, so I would assume you guys have as well. They're dental powders. Now, there's a lot on the market that just don't have research right now. This one in the bottom right corner is the only one that has the VOHC approval. So talk about some benefits. They contain ingredients like sodium hexametaphosphate, which is basically just an enzyme or a molecule that helps break down tartar buildup. And then others have enzymes and probiotics that aim to improve overall health. And they're nice because they're convenient to administer. You just put them on top of food, makes life easy. One thing I will say again is a lot of these don't have research backing them. And I don't think they're going to be dangerous for your pet at all, but it's just something to note that it might not be worth the money or time spent on it. One thing, they don't actually have mechanical force applied to them, which the chews do. That's an action that's removing plaque and tartar from the teeth. And it might be something that's great for pets and might be great for your pet specifically, but I don't think there's any way to make a blanket statement that like this is amazing, this works for everyone. So just use with caution and go from there. So that concludes this lecture. Just in summary, just to recap, periodontal disease is one of the most common diseases seen in dogs and cats. It's chronic, it's progressive. We treat it, but we don't cure it. Tooth resorption in cats is very painful, and we need to do something about it. And if you or your veterinarian look in the mouth and see something that's concerning, talk about it and make a plan. And then again, oral trauma is really common, and you just want to check what your pets are chewing on at home, make sure it's safe for them. But overall, this multimodal approach to your pet's oral health is the best thing to do. So you bring them to the vet once a year, bring them to your primary, just have them do a full exam, but of course, make sure everything looks okay in their mouth. You at home can also do oral exams on your pets. I know myself, I do them for my pets when they let me. But you guys will be the first ones to actually notice small issues and small changes in your pet's mouth. Like you might see, oh, that tooth looks different than it did 2 weeks ago. There's a little bump or a growth on the gums here. But if you see those things, it's worthwhile having it evaluated by your vet. And please do your best if you can to brush your pet's teeth. Use oral health products at home that you want. Just make sure you're using one that has the VOHC approval. I think it'll be at least worth your money and worth your pet's time as well. And then lastly, the anesthetized oral professional evaluations with professional cleanings with an appropriate treatment is the gold standard for treating any condition in the mouth. I think a lot of people always ask, well, how often do I do this? Or is this right for my pet? I wish there was a way to give a blanket answer of like, yes, every pet should have it this many times in their life, or you should start at this time. But every pet's different. Every individual pet will have a different inflammatory response to things like periodontal disease or tooth resorption. And it's really just going to be based off what your veterinarian kind of notes of their exam. And these are my pets at home. That's Babe on the left and Sunny, very much personality picks. But thank you all so much for attending this evening. It's been a pleasure speaking with you. And now, if you have any questions, we're opening the floor.
Well, thank you so much. This was wonderful. Very, very thorough. We do have some questions if you want to unshare your screen so we can see you, but your cat and dog are adorable too. But yeah, thank you. This was really, really terrific. All right, so let's get to some of these questions. We have several people asking about tennis balls that are made for dogs, but if they still have the felt, I imagine, what do you think?
If it's the chuck it ones, like the rubber ones, is that what they mean?
I think they mean the felt ones. There's the, actual ones.
Yeah, I just worry, like, look, I'm not going to sit here and pretend the lab in this picture that I showed you doesn't go crazy when she sees a tennis ball at the park. But I can't rip it out of her mouth either. So limit their exposure to it. Like, don't let them sit there for hours at home and chew on them. I'm a firm believer that there's gold standard treatment and there's also letting our pets enjoy their life.
Okay, no, that's fair. And then we said bones. People are asking about Nyla bones, which I
Mhm.
believe we don't recommend, correct? Or yeah.
Yeah, so the nyla bones are definitely destructive. I've seen many teeth broken from them. Now, if you have a puppy at home and you're using the soft puppy nyla bones, that might be, they're much softer, but it's not something you want to use into adulthood by any means.
Okay, great. What about finger brushes? People are
Great
asking.
question. Finger brushes often don't have really soft bristles, and the reason I showed you all that Nimbus toothbrush is because the bristles themselves are so soft and comfortable. We actually can see in people too, if you brush too hard or use too hard of a toothbrush, you can have gingival recession from it. So if you're able to brush their teeth with a finger toothbrush, great if that's what they let you do. But if they're able to do that, I bet you can do with a normal brush.
Okay, that's good. Okay, we have some questions about if um, if it's an older pet and they can't go under anesthesia or they're worried about that, is it still good to do some sort of a cleaning, professional cleaning? I know we don't, obviously
Yeah.
without anesthesia, we don't
No,
do
and
there any
I,
benefit, I guess.
yeah, it's hard to say really. And I think it's based off your individual pet. I think you got to evaluate why they can't go under anesthesia, is the first thing. And then the thing about the cleanings is you're not going to address the real issue of the teeth. And the main reason we want to clean the pet's teeth to begin with is to treat any disease.
Mhm.
Beyond that, like if they have bad breath, it's probably from periodontal disease. Just plaque and tartar buildup doesn't really affect them. So it's more of a cosmetic thing at the end of the day.
Okay, no, that's good to know. We have several people saying that they're unable to go near their pet's mouth. I mean, which could be maybe
I get
painful,
that.
right?
I
Yeah.
get that.
Yeah, and just I guess advice on that.
Yeah. Um, I I brush my dog's teeth. My cat, I agree, he doesn't let me go near his mouth. One thing I've tried and what I would recommend trying is just that desensitization technique and do it over a much longer period of time. So give it like 2 weeks of you showing the toothbrush and having a treat on it, and just let them lick it off once a night for 2, 3 weeks, and really do a slow transition over. And if you can't, you can't. Not every pet's gonna let you do it, but just do your best.
Okay, great. And we do show that in the video, to do it slowly. So we'll send those out to everyone. Let's see. We also had someone, if they don't have access to AMC, are there things they should be looking for? Any red flags, green flags in finding someone a veterinary dentist?
No, I just think having a frank conversation with your veterinarian beforehand is really what to do. Just again, make sure that they're the ones doing the surgery and that they have dental x-rays or are comfortable with anesthesia.
Okay, great. We have a question about if a cat has chronic kidney disease,
Hmm.
is it okay to do it clean to go under anesthesia to
So it's actually really interesting. And I appreciate you asking that question. In humans with chronic kidney disease and periodontal disease, they actually are recommending periodontal treatments every 3 months. Now, of course, we don't go under general anesthesia for that. So, depending on how severe the kidney disease is, I'd say that traditionally they do well, and it may even have some benefit, but I'm not going to sit here and make that claim with assurance because we don't have the literature to back it. It just has to, at the end of the day, be something you're comfortable with and that your veterinarian is comfortable doing. But we take care of a cat with kidney disease at least every other day here.
okay. Let's see. How often, I think you said how often, about once a year, you're saying, or
It's It's really individualized. I say as a general rule, small dogs with known periodontal disease probably need it roughly every once a year, unfortunately. But like my lab that I was showing you guys, she's got a pretty healthy mouth. Like there are some dogs that are just not prone to periodontal disease. Um, and it's unfortunately just so individualized.
okay, okay. We have a question. This is cute. They have four cats. Do they need separate toothbrushes for them?
Maybe two. I
Yeah, okay.
yeah, they're they're not the cleanest.
Yeah,
I'm sure they groom each other all day too, so
right.
clean them in between brushing and stuff to the best of your ability.
Okay. Um, and then we asked about, have a question about soft food, whether that
Hmm.
can lead to dental disease.
I don't think soft food directly leads to periodontal disease, but I do know that hard food and crunchy food absolutely reduces plaque and tartar buildup. Now, if your pet has any metabolic issues and needs to be on a wet food, yes, keep them on the wet food. That is paramount to, plaque and tartar, but definitely just consult with your veterinarian on what's best for your individual pet.
Okay, great. Are there any new updates on stomatitis treatment beyond tooth removal?
There are some really interesting stuff, and still the gold standard treatment for stomatitis in cats specifically is to remove all of their teeth. A third of those cases are refractory to treatment and typically are on immunosuppressive medications. But there are stem cell therapy medications that have become commercial that are available. Some are still in clinical trials, and these things are being used for a vast amount of inflammatory and autoimmune conditions. And there's also actually some newer research looking into the FIP drug as a
Mm.
treatment for patients with Calicium virus and stomatitis. So it's an exciting time. Hopefully, we'll see some really good results.
Okay, great. Someone's asking if a Nimbus toothbrush will fit in a small schnauzer's mouth. I think they have the kids ones, right? The
Yes,
little
thank
ones.
you.
Yeah,
There's
yeah,
the NIMBY one
yeah.
that I would recommend. Sorry for not highlighting that before. Thanks for asking that.
Yep, great. Let's see. You spoke about wipes and powders and
Mhm.
everything. I think still brushing is the best,
Yeah,
right? Yeah.
yeah. If you can brush, please do. If you can't, those additive medication or therapies will help to some degree.
Okay. Okay. How often should people replace the toothbrush?
Whenever you see the bristles like getting worn, just like you would for your own, is when you should replace it.
Okay. All right, great. And then you talked about greenies a little bit. I think you said it unless they're asking about greenies and cats.
Yeah, they're
Those
good.
same,
As,
same, but
as
as long
long as
as
they're chewing on them, it's the most important thing that they're actually chewing.
okay, great. Let's see. Do you do a dental on two people are asking about dental on dogs with tracheal collapse.
We do it commonly. It that is something that you would definitely want to have your veterinarian be comfortable with. We do those often here because of our anesthesiologists that are, very common with these pets that have multiple other systemic issues, but can be safe as long as your dog's otherwise healthy and the tracheal collapse is controlled. But again, that's based off your veterinarian to decide.
Okay, great. And then maybe we just want to hit home on this. Are there any dog bones you'd recommend?
I I do like bully sticks. They can be safe for teeth.
Yeah.
Just again, if your dog has some underlying enamel disease, then don't. But the rubber chew bones are really what's safest and best for their teeth.
Okay, no, not right, not the hard bones. I
Yeah.
think the thumbnail test. I
Mhm.
know we've mentioned like you should be able to put
Yeah.
a dent in it.
Yeah.
Yeah.
Thank you for bringing that up. Like if you could dent your fingernail to it, it's probably safe for their teeth.
Okay, great. Let's see. I guess about bad breath is not normal. We want to,
Absolutely.
right? Okay, let's see.
Absolutely.
Someone's
Bad
asking that.
breath is not normal by any means. Definitely warrants further investigation.
Okay, great. Are there specific nutrients or types of soft food diets that promote better oral tissue healing and long-term gum resilience?
That's a fantastic question. We don't have any literature looking into that, but I'm now intrigued. So I'm going to do
Okay.
some research into that.
Okay, very good, very good. Well, everyone, thank you so much for those great questions. And Dr. Cingolani, this was fantastic. Thank you again for, letting your time and expertise for this. This was really terrific. Thank you, everyone. And just a reminder that we will be sending out the link tomorrow if you want to watch it again or send it along. We're getting lots of hearts and everything and applause. So again, this was really terrific. Thank you everyone for spending part of your evening with us tonight. And we hope you'll join us for next month's webinar, which is Meeting Your Dog's Needs. March 25th at 6 p.m. We'll have the link going out in our newsletter that goes out this evening. So again, thank you, and we look forward to seeing you next time. Thank you again, Dr. Cingolani. Really
Thank you.
terrific.
Thank you, Michelle. Thanks everyone for being here. Have a good night.